Hi, my name is Juliana Cardillo, and I am an intern at my current workplace. I work in a community hospital in South Jersey. I work in the case management and social work department, and we assist with discharge planning. I have my coworker here with me as my mock patient. For confidentiality purposes, the patient's name is Joe, and his wife's name is Julie. So, on a normal basis, this conversation would take place at the bedside with the patient and the family member present. So just some history on the patient. The patient is a 76-year-old white male who's presenting from home. He came to the hospital with congestive heart failure, COPD, and end-stage renal disease. Over the past few months, he's been in and out of the hospital and in and out of rehab. So the patient was examined by the palliative care team at the hospital, and the family is requesting to speak to social work about hospice options. So in my case presentation, I will be using the solutions-focused intervention and empathetic listening. This technique is effective when working with this type of population because it can help with coping strategies and kind of help them understand and cope with such a hard situation. Hi, Joe.
Hello.
Hi, Joe. My name is Juliana. I'm with the social work team here at the hospital. How are you?
I'm doing good.
Good. I'm just coming in because I know that the palliative care team came this morning to talk to you and your wife about some hospice options, correct?
Yes.
Okay. I know previously, when you were here last week, we discussed maybe you applying for Medicaid, trying to get you into long-term care. I know you applied and fortunately you make over the wage amount, correct?
Right.
Okay. All right. So what I did was I printed out a list of hospice agencies in the area for you and your wife to look over, okay? I'll give that to you. Do you have any questions or concerns?
No, I mean, I was interested in long-term care, but now that they brought the hospice to me, I'm thinking that's what I want to do. I just want to go home and pass away peacefully with my family. My only concern is just being a burden to my wife and, what's going to happen to her when I do pass away.
Okay. Well, I do agree. I think that hospice at this point is the best solution for you due to your current readmissions and you're in and out of the hospital. I know you exhausted all of your rehab days. So I definitely think that you're making the right choice. And regarding your wife, hospice does offer services up to a year, bereavement services for family members. And they also have sessions and other community resources that will be available to her, okay?
Okay.
Do you want me to give her a call and let her know that I left a list for you guys to look over?
Yeah, we talked about it, but if you could go over it with her and just a little overwhelmed, not sure what else to ask.
Okay. Well, if you have any questions, once you sign up with a hospice agency, you and your wife would have to sign consents and they'll go over everything with you. So if you have any questions, you can ask them, okay?
Okay.
All right, and we'll be in touch shortly.
Sounds good.
All
Thank
right,
you.
thank you, Joe.